My name's Laura. I'm one of the Band 5 physiotherapists who works in orthopaedics here. And I love my job because I like the opportunity to get people up as soon as possible and on their feet after surgery, and to get them home to the quality of life they want to return to as soon as they're able to. I love working at the Golden Jubilee because of the fantastic team we have here, not only in the physiotherapy department, but also the wider multidisciplinary team on the ward, and how we're all focused towards improving patient care and creating the best patient experience possible.
My name is Marscheider. I'm one of the senior physiotherapists working within the cardiothoracic team here at the Golden Jubilee National Hospital. My job on a daily basis involves working with patients after cardiothoracic surgery, involving mobilising patients and improving their respiratory function to get them back to a baseline for discharge home. The best thing about working as a physiotherapist here is the patient journey and being involved in that, from when patients are pretty unwell after surgery to them getting home and back to a baseline.
Golden.
Hi there, my name is Amelia. I'm an occupational therapist here in the Golden Jubilee Hospital. I work here in orthopaedic rehabilitation, and my role is to help facilitate the person returning to their independence after their joint surgery, and also help planning in their discharge. We look at the person in regards to looking at their home environment, if they may need adaptive aids or equipment for their home, such as a kitchen trolley, for example. We also look at assessing the person with regards to helping them with getting dressed after their joint surgery, assessing them in the kitchen, making sure that they're safe manoeuvring around their own kitchen at home before their discharge. So that may be even making a cup of tea, for example, and safe sidestepping techniques. Other things we look at is just ensuring they're safe and manoeuvre around their home, such as looking at their bed transfers, if they're safe, and so as to prevent any, just to follow safe hip precautions if they've had hip surgery. And that's about it. And we also work closely with their family as well, just to make sure they've got the right amount of support that they may need. If not, we look at looking into any social services.
I'm Brolly. I'm one of the senior occupational therapists here at the Golden Jubilee. I've worked here for 10 years, and one of our roles is within the Enhanced Recovery Programme within orthopaedics. This starts at the pre-assessment clinic, when we try and start the patient journey as early as we can before they come in for surgery. We advise them on how to prepare their homes for after their surgery, order them equipment if this is required. Because we cover the whole of Scotland, we have partnerships with our providers throughout Scotland, and we have some good important links. This equipment is imperative for them for discharge if they've particularly had a hip replacement. From personal experience, my father has just recently had a hip replacement here at the Jubilee. He was very keen to come here because he'd had his other hip done in the past. He was very impressed with the service that was provided by all of the team, and he had a very good and successful outcome from his surgery, getting home from here in 48 hours post-surgery, and he is now doing incredibly well at home.
I think it's a really good hospital to be working in, especially as a newly qualified physio. It's an interesting place to work, where there's lots to learn, and I think it's a good place for me to develop my skills as a physio, which I'll carry on into my career.
My name's David Longhurst. I'm an occupational health physiotherapist working here at the Golden Jubilee. I've been working here for about 3 years now, and we provide a service for the staff members. We provide rapid access physiotherapy for the staff, which is incredibly satisfying. We encourage staff members and provide support for staff members to stay at work when they've got problems with their back or their hips or their knees or any musculoskeletal problems, to stay at work and provide a network of support to do that. We link in with management to try and get people back to work as soon as possible if it's in the person's best interests, which again is going to greatly improve their quality of life. So it gives you a tremendous amount of job satisfaction doing that.